In terms of capacity building, we need to look at a longer term capacity building. And that's where I did mention about the nutrition curriculum. That's currently underway, and we do have some students enrolled in the Institute of Medicine Masters in Public Health Nutrition. So I looked at one way to provide a long-term capacity, and in specifically focusing on, I know BBNC, it focuses on providing nutrition training, or they are basically focused on nutrition research and training, and that's what one of my field experience in Uganda and Nepal, if I have to share, is that a lot of times when we're in the field, we find it very difficult to segregate our technical knowledge between working in a program and working in a research. So that's what we usually come across when we are training enumerators and supervisors, and that's where I think that's another realm where we can focus on when we are focusing on a long-term capacity building, that countries like Nepal and Uganda need to focus more on research-specific trainings as well.
Well, similar things are happening in Uganda. I mean, there are students that are supported by the program through whose thesis and research we are able to generate important results to inform ourselves and policy. We are also developing a program that is new, that is supposed to integrate agriculture, health, and nutrition. That again, if it's in country, it exposes more people to these issues and aspects. At the local government level, we work with the local government staff. We use them as focal persons for the activities we do. As much as possible, we recruit from their staff the people that we use in implementing the activities of the program. We are in constant touch with them. Before we go in, we have entry meetings where we introduce what we are going to do. And once we generate results, whether preliminary or final, we share them at that level. So that's what we are trying to do there in terms of capacity building. Thank you.
I cannot provide much insight in Nepal though, but I have heard, and there's been a project in India where they're doing that right now, and we are seeing some of that effect in a small scale. So there's the small software programs that they're developing and which is mostly focusing on nutrient foods that are locally grown and locally available. But I cannot give more insight on which and what. These are small corporate programs that they're coming and trying to build a public-private partnership with these kind of softwares.
Or even radio, TV, using those sorts of more traditional.
Yes. Yeah, with radios we have programs. It's called road drama, there are programs that are aired through radios where the importance of nutrition, especially in maternal health and the first 1,000 days, they are focusing, and we have heard about, and I have actually heard about those kind of programs being aired in rural areas as well.
What I can say about Uganda is that the community connector is using radio programs in the areas where they work, and of course radio waves go beyond the geographical areas of their focus. So yes, the programs are there on radio. In terms of ICT, people texting in questions and whatever, we have more of that in agricultural extension. Maybe it's another area we need to explore in terms of nutrition, extension information, since the platforms are already there. But in terms of influencing young people and their mothers, there are many programs through the Ministry of Education, through the school gardens. I have a bit of this, but I did not have time to share all of it. The idea there is to influence the young girls. The target is the boys and girls, but the focus is on the girls, so that when they go home, they carry these messages to their mothers, and hopefully that way you can have these messages widely disseminated. Thank you. The two sectors work together at various levels. And I did mention in my talk about the OPM, which is we call it the super ministry. That's the office of the Prime Minister. It has a coordinating role for these cross-cutting activities. So at that level, it does happen. Sometimes there is some friction and competition, which I think is sometimes healthy because it brings about certain problems which need to be addressed. So at that level, yes. At university level, which I'm familiar with, we work very closely with our colleagues in the College of Health Sciences. We cross-teach courses. We have a course in human nutrition, which is based in the College of Agriculture, but about 50-50 is being taught across the two colleges. So there are some collaborations at various levels. At the local government level, I think there are also mechanisms, platforms for the two sectors plus the other sectors also to work together. So there are various levels. The second part of your question, I think, was on agriculture extension. To the extent that I know, agriculture extension in Uganda focuses largely on the production aspects, the new production technologies, the new inputs, and people have been complaining that the extension messages need to include actually marketing extension, and now I think you are bringing forward the issue of including nutrition extension. So I think the message of nutrition is not yet mainstreamed in the traditional extension services the way you know it. Thank you.
About the integration between agriculture and nutrition in Nepal, there is this Feed the Future initiative, Kisan, which is a knowledge-based integration of agriculture and nutrition. Since I haven't been so much indulged in agriculture extension programs, I have to apologize that I'll have to pass that on.
No, I just wanted to compliment Robin's answer in terms of whether or not there is a collaboration at the ministerial level. And in Nepal, because of the multi-sectoral nutrition plan that Robin mentioned, there is definitely collaboration at that central level and to some extent at district level. But what happens in terms of competing priorities is that people are trained across the board, across these different sectors, whether it's district agricultural offices or livestock offices and the health offices, to be sensitive to nutrition priorities. But in terms of enacting them at the ground level, there's a competition of just competing priorities of what you, as the while ministries are talking at the central level, it isn't in their plan to include nutrition at the district level in terms of implementation. And I think one of the more positive steps that Nepal has taken perhaps is more recently that at the district level, say the district ag offices in certain districts where the multi-sectoral nutrition plan has been rolled out, is that they included a budget line item for nutrition activities. So that's a step in the right direction, but there's still a long way to go.
Extension in Uganda is a hot cake. It's something that's not settled. You probably know we had the single spine extension system, and then we had the NADS, National Agriculture Advisory Services. The NADS was meant to do exactly what you talked about, where different extension service providers were supposed to access public resources. It was supposed to be private delivered, but public sector funded, so that different people with skills and expertise would access public resources and deliver extension services. But that one was disbanded, I think a few months back, and we are back to the single spine. So it's from single spine back to single spine. And the single spine does create a directorate for extension services in the Ministry of Agriculture, and that seems to exclude the so-called private sector. What I think really happened was that people who were working for government went out and formed themselves as private sector. So you had people in the government claiming to be government and private at the same time. And I think the policy processes were not pleased with that. So I think the way we are moving now, the private sector is being, I think, excluded from the delivery of extension services, I think, until probably we hear otherwise. That's what I can say. Thank you.
So with post study, we have policy process survey going on as well, and that's actually looking at how much problem defining capacity that the people at those stakeholding position or at the government level are capable of making that decision. And I think one of the most important, like you said, one of the most important avenues that we all need to agree is that there are significant lapses in identifying the problem at the first place. So I think with policy making and what we are doing with post research, I think that's where we are trying to hear more from the policymakers itself about what are the issues and whether they understand the priority in nutrition programming and implementation. And I guess if we get more information regarding that, then like you said, we can look at the nutrition outcome and then think about implementation plan that looks at either ways of programming.
I think what I can say in Uganda too, we don't use the approach of one size fits all. I talked about the radio programs of the community connector. They would be customized to the food commodities that are available in the different regions. Uganda too, it's small, but there are variations in terms of food habits, food systems, and the things that people do for a living. So those messages would be customized to those local places. The same would happen with like programs like the orange fleshed sweet potato. We don't promote that in Karamoja because they don't grow sweet potato there, so the interventions would be different. School gardens again would focus on the crops that are specific to the different areas of the country. Thank you.
Thank you. Thank you both. It's refreshing to get what I call a boots on the ground perspective. It's important for all of us, so thank you very much.